Hello and thanks for joining us on the FCT call center on ASO Radio and Television Services, Abuja. Today on FCT call center, we have the FCT Health Insurance Scheme, and we have the director, the acting director of the FCT Health Insurance Scheme, Dr. Salamatu Baugori. Thank you very much for joining us today on the FCT call center.
Thank you very much. I'm pleased to be here.
Yeah, thank you. You can watch the FCT call center live on DSTV channel 392, on StarTimes TV channel 127, and on Free TV we are on channel 507. You can also listen to us on ASO Radio 93.5. You can also watch us on the UHF band channel 38. Stay with us. We'll be back after this time out.
We were warned about this marriage. Because we did not listen, the young maiden is dead.
Nana, come here. Hi. Why do you speak so freely with a stranger from Ajani?
We were just talking about offering Ojigijag a seat on the council.
The gods be praised.
Legodo Zelko, Sisi. He has 2 wives. So why are you making it look like it is a big deal?
This is the FCT call center on ASO Radio and Television Services. Today we have the Acting Director, FCT Health Insurance Scheme, Dr. Salamatu Baugori. Once again, thank you very much for joining us on the FCT call center. Now, what are the achievements of the FCT Health Insurance Scheme last year? You also tell us the mandate of the scheme this year.
Okay, so good morning, viewers, once again. Thank you for having us, ASO Radio and Television, and thanks for the good job you're doing. The FCT Health Insurance Scheme was enacted by the FCT ESCO in 2006, but implementation of the scheme, the activities commenced in the year 2009. And the mandate of the FCT Health Insurance Scheme is to ensure that all citizens of the FCT, when they need healthcare services, they are able to access healthcare easily at no cost or very little cost to them. And in that way, we're able to have a productive and more healthy population in the FCT. Yeah, so the mandate of the FCT Health Insurance Scheme is actually to provide financial access, when financial coverage, when protection, when accessing healthcare services. Yes.
Okay. Now, how does the FCT Health Insurance Scheme ensure that enrollees have access to quality healthcare services through accredited healthcare providers?
Okay. So the scheme actually has various programs. We have the formal sector program, where we have all the formal sector staff of the FCT on board. We have the informal, we also have the area council formal sector staff on board. We have the informal sector individuals, private organizations, and then we have the vulnerable groups, which are catered for by the 1% consolidated revenue from the federal government fund, which is termed the Basic Healthcare Provision Fund, which is used to cater for the vulnerable persons. So for the vulnerable groups, we have about 37,000 vulnerable persons presently enrolled on the scheme, and then we have a total of over 199,000, almost 200,000 lives presently enrolled on the scheme and are benefiting services under the scheme. So now coming to the aspect of getting access to quality health care. We have a total of about 234 healthcare providers enlisted on the scheme. So for a healthcare provider to be enlisted on our scheme, we have to conduct an accreditation. So the accreditation is done in a way that we have a checklist that guides us through some certain criteria that must be in place before that facility is eventually accredited. It has we have steps and processes through which this is done, And once that is concluded and the facility meets up with the criteria to be able to provide quality healthcare services to our enrollees in terms of the structure, the human resource, the facility, the equipment, and all that, then we're able to enlist that facility on the scheme. As well, we go out for what we call monitoring and evaluation visits. So during the monitoring and evaluation visits, we also have checklists that guide us through how services are being provided, what are the major complaints from the clients. We have a process in place for receiving feedback from our enrollees. So and also we do quarterly, we just instituted that client satisfaction surveys. So we interface with our enrollees to get feedback from them on what their grievances are, what their complaints are, and then we go back to the healthcare facilities during the monitoring and evaluation visits, pick out things that needs to be addressed, and then we address those issues as much as we can.
Okay.
Yeah.
Thank you very much. We must commend the FCT health insurance scheme. In fact, you're doing well.
Thank you.
Your services at most of the FCT hospitals have greatly improved. I'm talking from a personal experience. Gone are the days where you have to wait for endless hours for approval code to come out. Now, just within some hours, you have it, and then you are good to go. But there are some services we must complain about. And we've received complaint from the FCT call center about some services that are actually supposed to be free of charge from the FCT, from the health insurance scheme. Once they give you code and then they direct you to the theater also, they make you pay some certain amount. You must pay some certain amount to a private individual account. Why is that so? And we also look at the cases of drugs. Most times when you visit the health insurance pharmacy, most of the drugs there, you be made to buy it outside. Please, can you address this complaint?
Okay, so thank you for the compliment. We're actually doing a lot to ensure that our enrollees are satisfied, and also the healthcare providers are also, satisfied with the premiums and the payments of their capitations and fee for service. So, but in the aspect of enrollees going to the facilities and being made to pay for certain services, and especially into private accounts, that is not acceptable. And I would say at this point that if you're an enrollee of the FCT health insurance scheme, you are not meant to pay for certain services that are covered, all services that are covered under the benefit package. You're not meant to make payments for them. The only aspect that payment is being made for is co-payment for drugs, which is just 10% of the total amount of the drugs that you incurred. So for example, if your drugs cost 10,000 naira, you're just meant to pay 1,000 naira for those drugs into the hospital account and not a private account. So my advice will be, subsequently, if enrollees make such complaints or are confronted with such, they should put a call through to our call center at the FCT health insurance scheme and would address that immediately before you leave the facility. Because once they leave the facility, then it is their word against the facility. So you're not meant to make any payments, and moving forward, please, no enrollee should make any payments into private accounts. And if that is being demanded, then you should let us know, and we address it immediately and there and then before the enrollee leaves that healthcare facility.
Okay, I hope before you leave, you give the call center number so residents can be aware of when and which number to call. But the issue of drugs, can you please address?
Okay, so for the issue of drugs, health insurance for now all over the country, not just in FCT. When we don't specifically purchase drugs and say these drugs are for health insurance enrollees alone, it's the duty of the facility to procure drugs and ensure that drugs are available to every patient, including the health insurance patient.
Okay.
There was a time in the past where some facilities have what we call NHIA pharmacy or health insurance pharmacy separate from the main pharmacy in the hospital. But the new trend and the moving forward for now is every patient should be treated the same, irrespective of whether you're health insurance or you're paying out of pocket. So in the FCT specifically, I know the drug situation has actually improved because our mandate secretary of Health Services and Environment Secretariat, Dr. Adedola Pofasawe, and the permanent secretary have put a lot of measures in place to address the issue of out of stock for medications, not just for the health insurance patients, but for every patient. And very recently, I was at Gwarimpa General Hospital, and we just had, on the spot interviews with some patients, both health insured and non-health insured, and they testified to the fact that the issue of paying out of pocket or going outside the hospital to get drugs is becoming a thing of the past. The situation has improved. We're not yet where we're supposed to be, but it has actually improved, and work is still ongoing to ensure that the situation even gets better. So, yeah.
Okay. Now, the FCT health insurance scheme surpassed the enrollment target set by the Health Services and Environment Secretariat for 2024. That's last year. What measures were put in place to achieve that feat?
Okay. Thank you very much. The enrollment target for the year 2024 was 25,000 lives to be enrolled in the year. And this was surpassed by additional 11,000 enrollees. What we did to achieve this was actually, there was a lot of backlog of outstanding payments for capitation and fee-for-service to the healthcare providers. So there was lethargy on the part of the healthcare providers to provide services to our enrollees. So we approached our principals, and in turn, they also approached the Honorable Minister of FCT, Barrister Wike, and who graciously approved payments, back-to-back payments of most of the outstanding from the year 2022 till the year 2024. We still have a few outstandings because of the processes with which how those payments are made, because some are prepayment and some are post-paid. The claims are post-paid. So a total of about 4 billion naira was paid out to the HMOs, and those payments went to the healthcare providers. So, that brought about a lot of hope and ignited more, willingness on the part of the healthcare providers to provide services to the enrollees. So with that, a lot of the enrollees, when they go to the facilities and they get to testify that the health insurance scheme is working better, people tend to now go more and enroll. As well, we now try, apart from trying to address the aspect of, quality service delivery by paying the healthcare providers that when due, we also try to, improve on awareness and sensitization campaigns. So we leveraged on every activity that happens at the Health Services and Environment Secretariat. So if our sister agencies are, flagging off malaria campaign or polio campaign, we go there, we talk to the women, we talk to the people, we sensitize them on health insurance. And on the spot, we see a lot of people, even paying there and then to enroll into the scheme. As well, there was a physical verification exercise that was conducted by the FCTA. So we leveraged on that exercise and we did a revalidation of our enrollees under the formal sector scheme. And by the time we were done with the revalidation, a lot of probably new staff or some old staff that were not ab initio enrolled on the scheme, got enrolled. Some got their documents revalidated. Some got their FHIS numbers, updated, and so that was how we were able to increase and boost the numbers to that, surpassing the targets that was set for us at the FCT health insurance scheme.
Okay. How does the FCT health insurance scheme raise awareness as well as educate residents on the importance of health insurance?
Okay, so raising awareness at the FCT health insurance scheme, we actually have various strategies that we use to raise awareness. So we try to map out what are the kind of populations that we have challenges with, what are the populations that we're targeting more for them to get on board, or we feel that they're not even aware about the scheme, and then what are the challenges for getting even on board, because the premium rate is, for now, is 13,500 naira, which is going to be reviewed up very soon. We're actually in the process of reviewing our benefit package. There's a technical working group that is presently working on that and our operational guideline. So once that is reviewed, we'll have an updated benefit package would use to also inform our enrollees so that they get informed, properly informed on what are the services that I am entitled to as a FHIS enrollee, so that when they go to the facilities and you're asked to pay for a service, you can show it to them that this is what my entitlement is and I'm not meant to pay for this, and then you let us know if we need to come in to address the issues. So coming back to your question, can you
educate? How you educate?
Okay, so how we educate, we use various strategies. So we use radio, media jingles, television, just as we're doing now. We also go into the communities, use our town criers. We were able to, there was a missing gap in engaging the area councils. We have zonal offices, quite all right, in the area councils. We have 7 zonal offices, but we realized that the structures on ground in the area council, like the health educators and the advocacy, communication and social mobilization team of the area councils, were actually not on board in supporting us with sensitization activities. So we had a series of meetings with them. We're planning a training with them very soon. This slowed down, has slowed down because of the ongoing area council strike. So once the strike is called off, we're planning a training with them, and then we'll work with them so that the already existing town criers that they use for other health activities like immunization, maternal, newborn and child health week, we get to have those same facilities, those structures on ground, to move into the nook and cranny of the communities, to talk to them in their local languages about health insurance and how does it benefit them and how do they access the services. So those are the various ways that we're using. We also leverage on some World Health Day activities like Universal Health Coverage Day. We go out on the streets, we'll have a road show where we sensitize the public on health insurance. We also go from SDA to SDA in the FCT secretariat. We talk to them about health insurance, we listen to their grievances, and we see how we go back to the facilities. There was a meeting we held with the Area Council Services Secretariat, the staff, formal sector staff, and we got a lot of feedback, and based on those feedback, we were able to go back to those specific facilities that were, giving us much problems in terms of service delivery to our enrollees, and we're able to address some of the grievances at those healthcare facilities as well, to ensure that those complaints are, brought down to the barest minimum.
Okay. Now, let's look at, you've talked about how you raise awareness. Now, let's look at how you monitor the quality of care provided by accredited healthcare providers to ensure that enrollees receive appropriate treatment.
Okay, so when it comes to the quality of care, we have a unit in the scheme called the Standards Quality and Assurance Unit. They are saddled with the responsibility of ensuring that all healthcare facilities that are empaneled on the scheme, meet up with certain standards and certain level of services delivered to our enrollees. So they go out periodically to see to the fact that services are being provided to the enrollees and also being provided the way they're supposed to be provided. So we have also checklists for this, which of course are still we're currently reviewing some of those things. We also have service level agreements with the healthcare providers, which also is presently being, immediately after we're done with the review of the benefit package, we're going into the SLAs, that's the service level agreements between us and the healthcare providers and between us and the HMOs, health maintenance organizations, to ensure that those agreements, are being, they keep up, they meet up with certain things that were embedded in those agreements. And when that is not done, for example, we had a case somewhere in Buhari Area Council, a facility that was denying our enrollees services despite being paid capitation and fee for service. So we wrote to them. There are steps in which we address some of those things. So there's a sanction, and after a particular period, if you don't yield to you don't improve on what the issues are, then we delist you from our. We give you like a temporary suspension before eventually we delist you. So because we have started to do this, because health insurance, a lot of people have the a misconception that health insurance is not working.
Yes.
But it doesn't take just the health insurance scheme for health insurance to work. It also takes the healthcare providers to play their own part, provide the services as at when due and when necessary, in the right way and in the right manner for the enrollees to be satisfied. So, and we don't procure drugs for now. I know that the federal government is through the NHIA are in process of trying to see how they can bring on board pharmaceuticals into the country, or our own locally produced medications, which would now make availability and the cost of medications, way better. And that way it would resolve most of the issues around drug supplies, which is one of the main things that informs satisfaction. Because when a patient goes to the health facility and you wait for hours and at the end of the day you don't get your medications, then that patient is invariably not satisfied, even if that patient got the best of services. But for the fact that the patient is not able to get the medications, there's really that the satisfaction is not 100%. So we're working on that aspect to see how well the aspect of drug supply and medication availability to our enrollees is going to be resolved moving forward. Okay, I think.
Okay. Now you've talked about funding, so let's go to the issue of are there any implementation for new healthcare initiative in the health insurance scheme?
Okay, yeah. So we have innovations in the healthcare in the FCT health insurance scheme, such as the adopt and enroll. We're not relenting. We go out to meet various philanthropists. We go to see political office holders to see how they can, support to pay on behalf of their constituencies or indigents, to pay on their behalf for health insurance. So very recently, we got a good Samaritan that paid a lump sum to enroll quite a very large number of persons into the scheme. So we went out, enrollment was done across the 6 area councils in support with the area council services secretariats. They actually went into the communities and identified very poor and indigent persons. Those lists were provided to us. We went out and enrolled those persons. We also went out to the facilities, and already testimonies are coming in. Even as at yesterday, my PR team were at Boa Regional Hospital to receive testimonies, and those testimonies are very mind-touching, because a lot of people out there need services, but healthcare services, and they cannot afford it. So I want to use this medium to call upon well-meaning Nigerians who can afford it. It doesn't have to be a very huge number. You can decide to pay for 10 persons, you can decide to pay for 50, 100 persons, pay on their behalf, and we enroll them into the scheme, and we share testimonies with you, and you feel good that you're helping and touching lives, especially children and women. So, yes. And in addition, trying to see how other means of getting funding sources for the scheme. We have, apart from getting philanthropists to pay on behalf of lives enrollees, we have, we're trying to see how we can, get equity fund. Equity fund is meant to be paid by every state to support the enrollment of citizens, especially those that cannot afford it. So for the FCT, because we're not yet, our law is not yet in place, we have not yet started to receive the equity fund, which would help us, because enrolling people in the informal sector is a very big challenge, not just in FCT, across the country. But, from the 100, almost 200,000 enrollees that we have, less than 10,000 of them are from the informal sector. Yeah, so we've been working around the clock to see how well we can penetrate into those informal sector. I even had a discussion with someone yesterday around microfinance banks coming to support us,
Yes.
so that we can meet with their associations, like Association of Okada Riders, so that you can, some of them are willing, but they cannot afford the 13.5 at
Lump
once,
sum,
lump
yes.
sum. So they can pay instrumentally through the microfinance banks, and those ones pay the lump sum into the health insurance scheme, so that they can benefit from the scheme. So that in the event of, most of them are prone to accidents and all those things, market women and all that, we're trying our best to see how well and how best we can get to bring them on board, pending when the equity fund would, come to light. That's when the health insurance law comes into, bill is passed into law. Yeah.
Okay.
Thank you.
Now, before we go, what are the major challenges of the FCT health insurance scheme?
So every sector, every organization has challenges. So I would not say we are without challenges, but we're trying our best to see how well we can navigate around those challenges. So one of the main challenge we have is the issue of the law that is not yet to be passed, because it's hindering so many things like the equity fund that we don't have yet. With the equity fund, we can enroll much more citizens and even move towards the drive towards universal health coverage. And health insurance is a game of numbers. So the more numbers you have, the more pooled funds you have to be able to help those that, for the healthy to be able to pay for the sick and cross-subsidize, amongst healthy, sick, rich, poor populations. So in addition, one of the major challenge that I identified when I came on board was the issue of claims management. So claims management is a very, technical problem, and if it's not detailed, if you don't address it in a detailed manner, you don't get to, because in as much as people say health insurance is not working, you still find people that would go to the facility and, request for antihypertensive drugs for 1 month duration. They collect it and keep.
Yes.
In the next 1 week, the same person goes, gets a prescription for antihypertensive drugs, gets it and keep. Whatever they do with it, I don't know. But, these are some subtle abuse of the system.
Yes.
We also have even claims from some healthcare providers whereby we have a claim for a patient. There's some drugs, that, okay, this particular injection should be given once a day. And that's the maximum. And then you now have a claim from one patient, and 30 doses of that injection was said to be administered to one patient in 2 days. And that is not possible.
Yes.
So what we're trying to do, and I want to really say thank you to my principals and the FCT administration on this, is the fact that the health insurance software solution, end-to-end software solution, is very robust, is about to be deployed. So it's going to be launched this week, Thursday, by the mandate secretary. The presentation is going to be made to her. And on Monday next week, we're going to migrate fully into the new software, which would allow us to have a handshake with our healthcare providers and as well our health maintenance organizations. And that way, we're able to monitor real time the issuance of approval codes, who is delaying the issuance of approval code, which healthcare provider is not providing services the way they're supposed to. There's certain things that would be put in place to monitor and also to address grievances real time on the software. So that would help us a great deal to also ensure that quality service delivery is being given to our enrollees and improve the scheme a great deal. And also for monitoring of accountability, it will improve efficiency and effectiveness of the scheme as well.
Okay.
Thank you very much.
Thank you. Before we go, can you reel out the call center number? And is it possible to have those numbers at the health facilities where people can easily reach out to you from?
Okay. So just before I read out the numbers, in addition to the software, it comes with our updated and up-to-date website. So on the website, we have the call center numbers. We're going to spread the link to the website for as far as possible. We're going to ensure that all our enrollees have those websites. There's a self-care portal on the website where you can go. you can decide you want to change your facility, or you want to enroll yourself, or you want to enroll a neighbor, you know, you can do all that on the website, and you can also have access to the phone lines on the website. So apart from the website, for the lay woman out there that does not have, you know, a smartphone and all that, the benefit package, once we've concluded and it's the update and it is launched, we'll have flyers and handbills pasted at the healthcare facilities. We'll have banners put at all our PHCs to ensure that they can see in maybe English and a few local languages to know what are they entitled to, and these are the phone numbers to call when you have issues at the healthcare facilities. So our phone lines are as follows. We have the first one is 070 422 4400. The second line is 081 045 45 again 502. And then the last one, we have 081 045 455 04. Yes. Thank you very much.
Thank you very much. We must commend you. You are doing well, and thank you very much for addressing most of the questions raised today. We have come to the end of today's edition of the FCT Call Center. Thank you very much, the Acting Director of FCT Health Insurance Scheme, Dr. Salamatu Belgore, for coming on today's edition of the program.
Thank you very much. Thanks for having me.
Do join us next week for another edition of the FCT Call Center. I am Hulina Adojo. We must say thank you. We must say thank you very much to those that have contributed to the success of today's edition of the FCT Call Center. Thank you very much to the Public Relations Officer of the FCT Health Insurance Scheme, our very own friend of the house and a former colleague, David Barrow. Thank you very much. Thank you to the Acting Director of the Department of Reform Coordination and Service Improvement, Dr. Jumai Amadu. And thank you very much to Joyce Ojo, the Desk Officer of the FCT Call Center. Do join us next week. Once again, I am Hulina Adojo. Thanking you very much for staying with us.